the founder and medical director of Innovative Health and Longevity, Riffat Qadir.
I have always wanted to become a doctor. This dream led me to become the ultimate South Asian nerd who studied 24/7 and graduate as a triple valedictorian, high school, college, and medical school. I was truly living the American dream as a student. You know, work hard, succeed. But I almost didn't make it through residency because of a thyroid problem. I stand before you today because I was able to get proper help. See, an interesting thing happened to me during medical school. I was the dummy that they used to locate the thyroid gland on a patient. See, my thyroid was so prominent that they used me. The professor would say, "Okay, everybody, come here and feel Riffat's thyroid. See that bulge? See that bulge in her lower neck? That's her thyroid." So while I'm being poked and prodded like a cadaver from anatomy lab, thinking to myself, why is my thyroid so abnormal? And why isn't anybody worried about it? Not even the professor. So this led to a series of doctor visits for me. But all they would ever tell me was, "You have a borderline problem with your thyroid. No treatment is necessary. Come back in 6 to 12 months. Over and over again, that's what I would hear. But you know, I was doing pretty good. Things were okay, so I kept going on with my life. After medical school, I got married and started residency training to become a surgeon at the Johns Hopkins Hospital. And then things changed. My energy level was so low that every step I took required a sheer act of willpower. That's how little energy I had. My poor new husband got no time and zero attention. Needless to say, this didn't help the relationship. So the marriage almost didn't make it to the first anniversary. And it impacted my career in a hugely negative way also. In fact, it got to the point that they were going to let me go. So now I was sure, it's like, hey, there has to be a problem with my thyroid. I'm going to go to the doctor. I'm going to have this fixed. Everything's going to be well. Well, not quite. So I go to the doctor, and again, your thyroid is borderline. No treatment is indicated. You're having a hard time with residency because it's much more difficult than medical school, especially for women. You should think about another career, you know, like public health. Oh my God, I'm thinking, public health? That's for people who didn't get into medical school. I was first in my class. So fortunately, somebody suggested I get a second opinion. And I did. And so this new doctor actually listened to me. It's like, yeah, well, your labs are borderline, but you're really having a lot of problems, so I think thyroid medicine should be prescribed, so you put me on Synthroid. I started feeling better. But that only lasted for a couple of months. Before I knew it, my energy tanked again. I couldn't keep up with my duties as a surgical resident. But to my good fortune, a professor of mine from medical school had just developed a revolutionary new way of treating thyroid problems. Dr. McDaniel taught me how to optimize my thyroid hormones and thereby my energy level. Before I knew it, I was leading the pack of residents at 5 a.m. surgery rounds. The standard medical system failed me altogether. My marriage nearly ended, and my life's dream of becoming a doctor was almost crushed. But this experience taught me the fundamental principle of how to really take care of patients, and it has driven the way I practice medicine. Being a true healer who significantly and meaningfully impacts people's lives is not about following established protocols and procedures. It's really about listening to the patient. It's about finding the underlying cause. It's for going beyond the standard of care and always being open and seeking new ways, new and better ways. I'm grateful for having the energy to live my life to the fullest and for the awesome opportunity of helping others live their life to the fullest. Thank you. Thank you.